Asteroid of fear.
Profound. All right. So
You don't want to forget that step, right?
that's exactly right. I'm like, you never know. Somebody could say the most profound thing at the beginning of a conversation and it's not recorded. So,
Yeah.
but I have a general outline kind of comprised of your stuff from Podmatch. But yeah, we'll just talk about, I'll get a little bit about your background and how you got into it, what interested you in this, and then kind of how it's evolved and um yeah, kind of what reaches that passion and should be interesting because I used to manage clinics, ambulatory clinics, and we used to hold sleep studies at one of my clinics. So
So you know a little bit about it.
I do, I do. I don't know
Yeah.
all the details. And I'm a terrible sleeper, so
Where are you now?
Texas.
Oh, okay. I'm in Nashville.
All right.
So,
Nashville. That's
will it
fine.
be, Richard, will it be done by 30 minutes max? 12:30?
We can.
Yeah.
Is that what you okay?
35 minutes will be perfect for
All
us.
right. Let's go for it. You ready?
All right, Rachel, let's go, buddy.
All right. And how do you say your first name?
Bijoy.
Bijoy. Okay. All right. Welcome to another episode of the Men of the House podcast. And on today's episode, I have Bijoy John, and we are going to talk about sleep. And as you might remember, I've had a guest on previously discussing sleep, but today we actually have a physician whose specialty is sleep medicine. So very interested to talk about this. How are you doing today, Bijoy?
Hey, great, Richard. Thanks for having me. Sleep is one of those things that's very underrated, but it is the superpower that we have. And I mean, my personal goal is to make sure many people realize the power that we have within ourselves, because once we discover and unleash this power, we are like super performed, superchargers. So that's my mission. And thanks for having me on your show.
Yeah, I used to remember hearing this when I was in the Navy. I went to this school and we had a test one time, and I remember just being so tired. And I was like, okay, I'm not going to study anymore. I heard this quote called better rested, better tested. And I'm like, I'm just going to go for sleep. And I did. I went for 7 hours, which was kind of a lot at that time, and did well on the test. And so ever since then, I've been kind of a fan of, you know, I've got my master's degree, so in studying for some of that, it was like, at what point does information stop coming in? But how did you get into sleep medicine? So you're a physician. Did you always want to grow up and be a physician? And if so, what kind of physician did you want to be? And then how did it transform into sleep medicine?
Great. So I have a similar experience. So right when I was in med school, I went to med school when I was 17. So, the exams, a constant part of my life. I have four
Mhm.
medical specialties. So early on, if I slept better, I took the test better. So, but this is in the 80s where sleep was not talked about. My mom always talked about sleep. So I realized if I, better rested, better tested, right? So when I sleep well, I did, perform well. So I was like, there's something about this. So what happens when you sleep better? Your memory is all organized. The brain gets a chance to put it all, whatever the information you learned, you kind of organize this and you're able to reproduce it better. So if you don't get a chance, those memories are not consolidated. So that's the answer. So yeah, how I got into this field, growing up, I had, asthma. It's a very interesting thing. It's called exercise-induced asthma. That
I had the
concept was
same
not,
thing.
yeah. So what happened is, when you start playing, you short of breath and it gets better. I was like, what is this thing? Finally, I become a, fellowship, pulmonary fellowship. Then that's when I realized, what this thing was. So early on, I know how it feels not to breathe better.
Mhm.
So the pulmonary was my fascination. My mom, and I shared this in my book called Nobody's Sleeping, that me and my mom had a major accident as a child, and there was one doctor involved in the care, and he really took care of her. and the decision was whether to cut her legs off or not. So this guy was like, no. So there was always that gratitude, and I become that doctor in many people's lives in the ICU. Sleep was always a part. I've been practicing this since 2000.
Oh, wow.
But 5 years ago, I just left after 20 years in practice, I left the intensive care unit and just said, hey, I'm going to focus on my real passion. In the past, it was 6 months to see me. I was a busy lung doctor, ICU doctor. Sleep always gets in the back burner.
Right.
But even in the ICU, I saw that if you let people sleep better, they heal better, right? So we wake people up all the time unnecessarily sometimes to check the blood
Mm-hmm.
pressure and all that. So I started my own clinic, wrote this book, and I'm over here promoting. So that's how I've evolved since starting med school in 1987, knowing the power of sleep. And here we are in 2024. I am completely immersed in this passion.
What do you think has changed in the world that's kind of, I mean, I kind of have some ideas, but, mental health is being talked about a lot more these days.
Yes.
And it seems like sleep also is one of those things because,
Mhm.
I came from an emergency room background.
Mhm.
And then when I went into management, I started managing ambulatory clinics, and we would have visiting specialties because I did primary care and urgent care. But we actually would have sleep medicine come. And in my clinic, we had 2 bedrooms set up for sleep
Sleep studies.
studies. And
Mhm.
that was 2015. And that was, you know, I assume I probably imagine that sleep studies went on, but it definitely seems to be catching on a little more importance with the world. Because like I have this Whoop band that
Mhm.
actually, helps track sleep. People wear the Aura Ring. I think Apple Watches have some functions, but do you have any theories as to why sleep is kind of more talked about now, more open?
So sleep is mysterious, right? Ever since the advent of the cell phone popularity, 2008, 2010, we have compromised our sleep, right? Because to get that extra few hours to be on our devices, we compromise the time to sleep. But it catches up with us, right? The
Hmm.
hustle culture is hustle, 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 compromise on your sleep. But then eventually, you have anxiety, depression. It's a bi-directional. The less you sleep, the more anxious you become. The more anxious you become, the less you sleep. It's a vicious cycle. So mental health is huge. So what really also dramatically changed was COVID. The
Hmm.
COVID has its own problem with sleep called coronasomnia, right? People are afraid of getting the virus, or you doubt your partner or your friend, so you worry a lot. And plus, Corona, the pandemic brought us working from home. So people had a dedicated 9 to 5 job, so they get, wake up at 6, get ready, go to work. Now, work from home, right? You have your laptop, computers, and so you sleep longer, go to bed longer. So though our clocks are changed, our anxiety is more. But somewhere along the line, people are beginning to realize the healing nature. Richard, when you have a problem in life, what do you tell each other? Hey, let's sleep on it. We never say let's exercise on it or diet
Yeah,
on it. So the awareness is becoming more because the sleep and mental health works together, or I can say it collided.
right.
And so all of a sudden, hey, when you sleep better, your mental health is better. So in that dialogue, so it was the sleep quality was getting worse, and then it got really weird after COVID, and now it has reached this climax or the worst. And then with the mental health talk, when people are aware and everybody's talking about getting good sleep.
Yeah, I think the mental health component, because I know like
Yes,
I suffered from some depression before COVID.
yes,
And when I went and told my primary care physician, hey, I think I'm depressed, they were like, and I'm not sleeping. They were like, well, the first thing we got to do is get you some sleep.
yes,
Um, and then of course started me on some medications, but sleep was kind of that pillar
yes.
of the beginning of getting better.
Mhm.
Do you is there, so I know like there's this thing of like, let's say you need 8 hours a night, but is there a true 8 hour, or is everybody kind of so different that some people function really well on 5 or 6? I mean, are people's physiology different enough to where there's an optimal amount kind of geared towards you and how you would figure that out?
Great question. So, there's some people are short sleepers. Elon Musk is a classic example, but he thought everybody is like him, but not everybody is like him. That's a genetic lottery. He functions well with 3 or 4 hours of sleep,
Oh,
but
wow.
that's the message that gets misconstrued in the media, and then the bigger, broader paint, the brush is that nobody needs a lot of sleep. You can die, or rather you can sleep when you die. I
Yeah,
literally tell
I've heard
people,
that.
yeah, so that's the message that gets out there. But in reality, all of us need somewhere between 7 and 8 hours. Children need more sleep. So because sleep is complicated, there are several stages and cycles. To get all the cycles and stages, you need about 7 to 8 hours. So the key question is, in the morning, when you wake up after sleeping 8 hours, how do you feel? If you feel great after 5 hours, hey, more power to you. You may be a short sleeper. But if you're still tired after 8 hours, then you might have a sleep debt. You could have a sleep problem. You could have medical problems that is affecting your quality of sleep, like people with asthma, emphysema, they don't breathe well at night. People with congestive heart failure, or people with diabetes who take medications. So those are many reasons you need to look into. So how you feel in the morning after consistently sleeping for 8 hours or whatever 5 hours answers that question.
Yeah, that's what I kind of like about the Whoop is that it kind of breaks it down for you, and
Yes.
it'll tell you how much time was spent in deep sleep and what, REM sleep and then deep sleep, and I guess it adds them up and says, X amount percentage of your time was spent. This is either optimal or not. And I found it interesting that even on some of the days that I had, like, let's say longer, like a 7.5 hours, my deep sleep was less. But then I had a night where I only slept like 4.5 to 5 hours, and half of my sleep was deep. And so it was interesting to me to understand that the total hours were less, but the quality within those total hours was actually more. Um, how does that work?
So it all
What
depends upon the
differentiates that?
It all depends upon the quality, not the quantity. So
Mhm.
there is this misconception that REM sleep is good for you. It's actually good for you for, many reasons like memory consolidation, conflict resolution, but it is not a restful sleep.
Right.
Stage three non-REM sleep is the most restful. So I call it the sweet sleep. So, usually we should get about 25% of that each night. So if you sleep 8 hours and you spend majority of the time in the REM sleep, you're not rested. So, so how much you spend in the stage three non-REM sleep is the most important thing. And I'm actually a guy. I'm not a big fan of those wearables because
Hmm.
people worry a lot. I tell people just get the data. Follow the whatever the guidelines, whether what I teach or you learn, and then install all that, follow
Right.
that, and have a follow-up night. Wearing it every night is only counterproductive because you're going to worry, hey, did I get enough this sleep, that
It's
sleep?
like performance anxiety.
Yes,
I used to, because I was such a poor sleeper in the past, I actually used to turn my alarm clock facing the wall so that
yes,
if I ever woke up in the middle of the night, I'd never know what time it was,
yes.
because then you would start creating that anxiety of like, oh my gosh, I only have an hour left to sleep.
That's great
But
advice.
that was a great point that you made about the REM and that stage three, because the wearable does kind of break that down. And I didn't know that previously. And so kind of understanding that for anybody who does wear that, understanding that that stage three is actually probably more important than the REM is kind of a big factor. not feeling like you have to hit that. But what are, if somebody comes to you, if I come to you and I say I'm a terrible insomniac, what are the first things you're going to, questions you're going to ask me, and first things you're going to get me to do to try to get to go to sleep?
Right. So when I see somebody with poor sleep, the poor sleep is the tip of the iceberg of what's going underneath you,
Right.
right? It's not as clear cut as why you don't sleep. So when I see somebody, I first have to go through my questionnaire, say, hey, do you have any other medical problems? Like as simple as, pain, back pain, neck pain, do you have a breathing problem, heart problem, lung problem, diabetes? So first I rule that out.
Hmm.
Then I look into whether you have a psychological problem like anxiety or depression, because that affects your sleep. And then I ask, do you snore? Or do you have a sleep problem or a sleep disorder like restless legs, REM behavior disorder, limb movement disorder? So once I find all that, then I say, hey, you have clear cut insomnia. Sometimes insomnia can be together with all the other conditions. So that's it's called comorbid insomnia. Two things can work be together. You
Right.
can have sleep apnea and insomnia. You have a heart problem and insomnia. They can be together. So within the first 15 minutes, I make everybody fill a sleep questionnaire. I know, well, what's your sleep score. Then I know how sleepy you are. So that's when I come to. So, and part B of your question is what advice? Once I think you have sleep apnea, I tell them to do a home sleep study. Once you have a restless legs problem, then I tell them, hey, we need to check your iron levels, which is one of the number one causes of restless leg syndrome.
What up? This is Ethan from the Nonchalant Perfectionist Podcast. Clearly, you got a great taste in podcasts because you're listening to this pretty awesome show. Just so you know, I'm also part of the Podcast Connection Network. Yeah, that's right. We got a whole network of shows dedicated to your mental health and holistic wellness, just like this show. We've got something for every mood and for every goal. So look, man, if you're looking to expand your horizons and explore some incredible content, just check us out. The link to the Podcast Connection Network is waiting for you in the description below, man. Enjoy the rest of the show.
So if you have a breathing problem or lung problem, I need to address that. So then I have this strategy called the Sleep Now program that I am promoting. So that's the acronym. My subtitle of my book is called Seven Proven Sleep Strategies. So the seven strategies, I use an acronym called Sleep Now. We can go into it whenever you're ready.
Yeah,
So that,
let's go for it now.
oh, you're ready then.
I'm
Okay.
ready. I'm ready. I want to know. I'm like, I
Yeah.
have restless legs, because I got burned as a child, and so I have some nerve damage on the back of my legs.
Yeah.
And
So
I
the
grew up with
treatment is
asthma.
time,
Yeah.
and you have childhood asthma. So, people who don't sleep well, their asthma gets worse at night. So,
Hmm.
um, so, so the Sleep Now acronym, all right, SLEPNOW. Your viewers can take it down. S is the schedule. For any plan to succeed, we have to have a schedule. So I tell people to sleep between 10 p.m. and 6 a.m. Why? Because a lot of good sleep, the stage three non-REM sleeps, happens early in the night. As the night goes in, as it becomes daylight, you get more REM sleep, and then the light comes in. You don't get any good sleep once the lights out. The whole world is awake. There's more noise, so you have to prioritize the sleep. So 10 to 6 is a perfect time. So by midnight, you have at least an hour and a half of good sleep. Then as the night goes in. So that's important. Next is L is low light, low noise, and low temperature. That is important because melatonin is only secreted in darkness and low temperature. Of course, noise affects your quality of sleep. So the word mela is darkness. So keep your room dark and also cold, 65 to 70 degrees. So the next is the big one, E, no to electronics, the
Mm.
light from the electronics. So I was telling you about the COVID. People bought work home and then the work they brought it to the bedroom, and here you are typing and looking at your phone. The light from the devices is telling the brain, hey, it's still daytime. See, the small children wake up in the morning, crack it down because the light. We all revolve around the light.
Hmm.
So we're not giving our body a chance. So I tell people to leave the electronics, get off electronics at least 30 minutes, and most importantly, don't keep it near to you. set an alarm. I literally keep it in my bathroom and set an alarm. Even this morning, the alarm went off. I walk, turn off. I don't get a chance to hit the snooze button. And also,
Mhm.
like you mentioned, in the middle of the night, you wake up. We all wake up in the night to use the restroom or some other reasons. Then you look at the phone, you know the time or notification. Somebody is wanting something, and then you're tempted to pick it up. Again, the light. So no to electronics. That's a big one, right?
Mhm.
So SLE. The next E is the exercise. Exercise releases heat, but heat's not good for you to sleep. So I tell people to exercise at least 4 hours prior, or if possible, at least 2 hours. Exercise also releases endorphins and cortisol. You're all revved up.
Yep.
So try to give your body a chance, because the next one is the P, power of your mind. So you have to give a body a chance by keeping your phone away, not exercising. You calmed your body down. Now you calm your mind. See, we want our sleep to be an on and off switch, but it never happens. It has to be a dimmer, right? So I teach two techniques to people to power off your mind. One is called vivid imagination. I've been practicing this for more than 30 years myself. So when I lay in bed, I'm thinking of the abstract. I'm not thinking about any reality. If I watch the show, I'm the director of the show, or I'm the hero of the show. So I start thinking about that. So my mind is in the abstract, not in reality. And then the next is the yoga nidra. So I tell people to lay on the back with the palms up and look at the ceilings and start thinking about the different parts of your body, starting from the head. So that's this progressive muscle relaxation, part of cognitive behavioral therapy for insomnia. So that's an excellent way to calm down. But remember, you cannot power off your mind until you give it a chance. So
Right.
the next is NO. I've combined. It's a no to worries. We all worry. I tell people to worry between 6 p.m. and 8 p.m. So that's my dedicated worry time.
I
I was
like
getting
that.
ready for your show. I saw, hey, what time is it? Eastern time, Central time. I said, okay. And then, so leave it, from 8 o'clock, you're getting ready to go to bed. You have to have a ritual. You have to wind down, hustle, hustle. We've been hustling, hustling all day. And now you're slowly, coming towards rest. And then the last in the acronym is W. This is win by losing. We are winning, winning, winning. But in sleep, you have to win by actually losing yourself and keeping everything simple. The hustle culture, I think, has met us match in sleep. We can hustle, we can data mine your way into sleep. You can, therapy into your way. So I tell people that all things considered, when you're entering the bedroom, as you enter the bedroom door, it's like a TSA screener. If you have your phone, beep, you got to leave it alone. If you have worries with you, beep, you got to leave it outside. So bedroom is only for, sex and sleep. If most people are either snoring or they're worrying.
Yep.
You follow this. I've helped many thousands of patients over the last 25 years. I'm up to like 50,000 patients. So, I perfected it. I suffered from insomnia when I was in med school, when I lost my mom, or when I started my business. But I found I use the same techniques what I write in my book, or, I'm not taking a single pill. I don't intend to, because we are a melatonin factory. We have GABA in our body, helps us to sleep. We have all that, but we need to give it a chance. Hey, it's not going to happen without you giving a chance. So that's my Sleep Now acronym. So many people are following it and getting better.
Now I've heard, I don't know if this is true or not. I find it to be kind of semi-truthful for myself, but I actually fall asleep easier if something is on in the background because I feel like my mind is too busy. So if
Yes.
there's like a TV on or something, it's just noise. I'm kind of listening to it, not listening to it, but I set a timer on the TV, fall asleep, and then let the TV go off. But is that true that some people fall asleep easier, that
Yes.
occupies the mind?
Yes, I've been always sleeping with a white noise machine,
Hmm.
always. In the past, it was the fan. Now we have my wife wants one. She He's a kind of like a light sleeper. Women in general are light sleepers. That's why I dedicated a chapter for women in my book. So white noise machine is excellent. I like soothing music. I like meditation. But the key here is you have to do it outside the bedroom. So most people have
Okay.
their things on and they keep your phone next to you. So get in the mood, leave your phone. So that you're dragging your phone with you even when you're listening. You're looking at other things. You're revving up your mind. And so it's I to answer your question, white background noise machine is excellent. Meditation music is excellent. Podcasts, everything is excellent, but don't tether yourself with a device.
Would you, knowing all that you know about sleep, do you think there will ever be any, um, how do I word this? Any shift, any desire to shift, or people taking a look at, let's say, like medical residency and the training? Because I worked in a level 1 trauma center where we trained residents,
Mhm.
and especially interns, first years are always sleep deprived and carrying like 3 beepers, and they work a lot. Do you think, knowing kind of what we know about sleep, do you think they'll ever change residents to not working 80 or 90 hours a week, or
That's been already changed. Nobody works more than 8 hours, at least in theory. We were
right?
trained to work 36 hours straight, but not anymore. The ACGME has really been strict and for the right reason. So the residency programs are much restricted. They don't work long shifts like they used to. So
Hmm.
that has come to fruition, at least in the last 10, 15 years now.
Well, that's good. That's good to hear,
Yeah.
because I hear what 24 hours, 48 hours lack of sleep is similar to having a couple of cocktails, and you probably don't want somebody who's had a couple of cocktails operating on you.
Yeah, 36 hours, your blood alcohol is equivalent to a blood alcohol of 0. 0.5, which is legally
Mhm.
drunk in some parts of the world and in Utah.
Um, so one thing I like to ask everybody before we hop off is, kind of, having gone into this field, what is one unexpected thing that's been a great benefit? Maybe you helped somebody, but never would have happened had you not decided to kind of pursue this sleep thing that was always on the back burner and follow that true passion.
So the more and more we're coming across how sleep improves mental health, how sleep prevents dementia, how it's important for controlling blood pressure. So every medical patient who's got high blood pressure, diabetes, heart problem, or even mental illness, they all need a sleep evaluation, right? Which
Mhm.
is medication. So the more aware people are, it gives me more, excitement to treat, people. And the best part of me writing the book and is people calling my office or sending me a note saying, "Hey, it changed my life. I didn't know blood pressure and sleep apnea was related. I didn't know, diabetes can be better controlled by controlling my sleep problems." And even mental health people come off a lot of their medication. So it empowers me now to treat more people because we all know. So the challenge on the other side is it doesn't hurt like a toothache. People put it away.
Right.
"Oh, we can do it tomorrow. Or you can take melatonin." And I'm anti-melatonin and all that because we are the melatonin factory. So we don't need any of those medications.
Yeah, that's the one thing I take the Ollie sleep gummies. Sometimes I don't have to take them all the time, but whenever I'm able to sleep without it, um, I get really excited.
Yeah.
Um, and then sometimes I'll use a cannabis edible to sleep, and that kind of helps. But there's nights where I've had some of my best sleep scores with no Ollie sleep gummy and no cannabis gummy.
Yeah,
Um,
there's any of those things does not improve sleep. It actually worsens sleep. It relieves anxiety. That helps you to sleep better. Cannabis and marijuana, THC is all does not. It actually worsens sleep. It only helps you by relieving your anxiety. So, so it's
it's
bad for sleep.
interesting.
Yes.
Interesting. Yeah,
Yeah.
and that's part of, you know, kind of wearing a wearable, talking to people like yourself, and learning more because I know, like, for me, the ultimate goal is um, to have some sort of routine where I could sleep naturally and, get a process down. Because I already wake up pretty naturally. I
Yes.
don't need an alarm clock, and I'm kind of thankful for that, and it's kind of consistent. But yeah, the getting to sleep is the hard part that I want to perfect. And I'll just continue to work on it. But thank you for your time today. And I just want to be a good steward of time for you. And yeah, I appreciate all the information. And again, like my last sleep conversation, it will be me trying to put this into practice once again and see if I can't get myself on a better sleep routine, and hopefully the listeners do the same. But, as you've mentioned here today, it seems like many of our issues can be fixed with a combination of sleep and also diet, we know. So they're
Yeah.
all kind of connected.
Yeah, sleep and diet, a huge relationship because when you sleep well, the leptin-ghrelin ratio is pretty normalized. Sleep is the foundation for fitness, weight loss, and everything. So that's why I decided write a book. It's called Nobody's Sleeping: The Seven Proven Sleep Strategies. And I have my website called Sleep Fix Academy. And I'm known as Dr. Sleep Fix on all the social media platforms, and it's growing. People are receiving my messages. I'm excited every day. I'm doing this short reels and follows
Yeah.
and shares, and it's well received because I know there's a lot of people are needing
Hmm.
this information, and there's a lot of information not backed by science out there. So I think that's what I'm passionate about. Being real and seeing many patients what works and what works not and how it works. And like I shared, I'm pretty straightforward. I tell people as is.
And
uh,
medication is kind of like a tool to maybe get you something temporary, but ultimately you want to, it doesn't want to be a long-term fix, correct?
right, yes. So if you have like an infection, you need to take the antibiotic because our body is lost that battle. But for sleep, see, the human hormones that we secrete to sleep, it doesn't come as a big dose. It's in pulsatile fashion. It gets a little bit and then a big rush, and then it's related to the core body temperature. But anytime you take a medication, your body gets tolerant to it, just like alcohol, right? So you
Mhm.
need the receptors get down-regulated, and then you need more alcohol. You might have a buzz with one glass of wine, and then tomorrow you need two. So same thing with medication. So if we have it, right? So if you take it from the outside, well, that only creates tolerance. I completely agree. I do use medication for short periods of time, like somebody's dealing with grief or situations in their lives, but I wean people off all the long-term medications.
Yeah, definitely. That's the hardest part. And I think especially for people who have those overactive minds and attempting to get to sleep. And so kind of like you said, setting that ritual and several hours before, stop the worrying, cut off
Yes.
the electronics, and kind
Yes.
of like you said, make it a routine of a kind of a slow burn into the process. And that's something I have to work on. I think we live in this instantaneous world where we're almost expected to turn things off and turn things off in an instant. And
Yes, sleep has found our match.
yeah.
Still cultures met his match. You have to work it. I say it's like a seven-course meal. You have to have your, salad, your drinks, your
Yeah.
appetizer. You can't go straight to the meat. It doesn't happen. There's no way out. But if you work hard at what I told you, the steps,
Mhm.
you do it for like 2, 3 weeks. People are during that 2, 3 weeks, they are unhappy with themselves. They're unhappy with me. They call some of them cussing. But hey, I said stick with it. By 6 weeks, they're great. They're like, so that's why I have my own online program and my website called Sleep Now.
Yeah. Got to
Like,
trust the process.
yeah,
But
stay tuned to that.
I'll include all that in the show notes, and
Yes,
expect some people to reach out to you. But yeah. Well, again, thank you for your time, and I'll send you an email and everything with the release date and whatnot. But it'll be soon.
thanks, Richard. I
All right,
really
man.
appreciate it.
All
Thank
right,
you a lot.
man. You have a good day.
Sleep well and be well, everyone.
All righty. You too. Well, that's a wrap. I hope you enjoyed the conversation. Please remember to rate, review, and subscribe wherever you get your podcasts from. Remember, go out and be the person that you want to meet.
Hey, go.